Hello viewers, I am here with the Hour's News from Tigray TV. I'm Mary Nimana. We'll be reading the news for you today. Stay tuned. Proceeding to the details. The targeted killing and harassments of Tigrayans across Ethiopia has become almost a daily occurrence. Last month, a massacre targeting civilian residents in Abala, Afar, would take the lives of hundreds of Tigrayans and displace many more. There are currently over 2.2 million internally displaced people across Tigray, with that number showing a steady increase due to the ongoing ethnic cleansing campaign in western Tigray and the continued killing and harassments of Tigrayans from other parts of Ethiopia. Our reporters visited an IDP camp sheltering newly displaced persons from Afar regional state that say they're not able to access basics such as food and medical supplies. Haile Gabru has more.
Internally displaced persons make up one of the largest groups of people in need of urgent humanitarian assistance. The over 2.2 million persons displaced from different parts of the state are currently sheltered in repurposed government and private facilities, with lactating mothers and children one of the highest to be affected. The number of internally displaced persons is only increasing as the ethnic cleansing campaign in western Tigray continues, and more persons are displaced from the other parts of Ethiopia, especially Afar, where regional forces have been committing gross violation of human rights in the area.
We have lived in Afar region for a very long time. Now we have been displaced by Abiy Ahmed's government. We never thought that such a day would come. Hundreds of Tigrayans have been brutally massacred in Abala. The Ethiopian government is conspiring to break the deep ties between the people of Afar and Tigray. We need food badly. Hunger gives no time.
They killed everyone they found at home. They also vandalized and looted private property. We came here to save our lives. We didn't carry any of our property with us. Now there is no humanitarian aid available here. Children are malnourished. An unprecedented campaign to exterminate Tigrayans is being carried out in Afar region. However, we are grateful for the people of Afar for their help. Very many tried to save our thousands of Tigrayans have been taken to Samara and are currently being detained there. We hear that they are suffering from hunger and diseases. Therefore, we call on all humanitarian organizations to hear our calls now.
The internally displaced persons say that they don't believe that horrific acts of violence committed against the people of Tigray were endorsed by the people of Afar, and say mercenaries paid for by the Abiy Ahmed's government are the ones that should be held accountable.
We went into hiding inside churches and behind bushes when Abiy Ahmed's forces started to brutally murder Tigrayans in Abala. Our properties were looted in broad daylight. They slaughtered both men and women in a gruesome way. Again now, we are starving to death. We need food and medicines as soon as possible. The government led by Abiy Ahmed is responsible for the atrocities committed against innocent Tigrayans in Afar. The people of Afar did nothing to harm us. We have lived together for quite a long time. We have shared cultures and values which can't be easily erased. What's happening in Afar against us is atrocious. Therefore, we call on the elders of Afar to condemn the brutality that is being committed by Abiy Ahmed's government. We have been displaced from Abala by Abiy Ahmed's mercenaries in Afar, not by the people of Afar. Countless number of people tried to help Tigrayans, but Abiy Ahmed's regime wants to destroy the bond between these two people. We seek justice for the massacre committed in Abala. We also call on the international community to take action on perpetrators as soon as possible.
The internally displaced people requested for the Ethiopian government to be abided by the international humanitarian law and lift the siege, which has put the lives of millions of Tigrayans at stake.
UK parliamentarian and former leader of the Labour Party, Jeremy Corbyn, says that the Ethiopian government has to provide access to human rights investigators to investigate the gross violations of human rights in Tigray. Jeremy also stated that any attempt by the Ethiopian government to reoccupy Tigray will have a devastating impact for hopes of a peaceful resolution to the conflict. Sabrok Nama reports.
Jeremy Corbyn, member of the United Kingdom's Parliament and former leader of Labour Party, says that any attempt by Ethiopian forces to reoccupy Tigray may have a devastating impact and will make a peaceful resolution to the conflict impossible to attain.
There is a danger that in the retreat that the Tigrayan forces performed after they couldn't get completely into Addis and went back into Tigray itself, that there will be a push for the Ethiopian armed forces, which are huge and considerable, to go in and completely occupy Tigray. It's a temptation, I'm sure, that the military commanders are looking at. The danger with that is that once they occupy it, they may not want to leave, and that will actually be the how should I put it, the spark that will lead to conflict and of the future. There has to be a coming together of some sort and an understanding of the federal nature of the country.
The parliamentarian also asked for the immediate end to the siege on Tigray and full and unrestricted access to humanitarian actors to reach the millions in need of emergency assistance.
From this chamber today, we can make an appeal to the Ethiopian government to allow the UN Human Rights Council, Amnesty International and Human Rights Watch unfettered access to all aspects of society there. They've not taken sides in the conflict, they've not issued a view on the conflict, they've issued a demand for peace and protection of people against systematic and sexual violence that has gone on there. Because this, as the member for Tewkesbury pointed out, is a humanitarian disaster of massive proportions. The figures are horrendous. You're looking at 9 million people that are short of food. You're looking at least 400,000 that are literally starving. You're looking at a lack of medical supplies. You're looking at a prevention of trucks getting into Tigray with the food, the medicine, and all the other necessities of daily life that the people of Tigray want. Many will die as a result of this. Many will lose their lives, and children will grow up with stunted growth and development, and the resentment will be there for all their lives of those that stopped the necessary aid getting in there.
It has been nearly 7 months since the Ethiopian government imposed an all-encompassing siege on Tigray that has restricted all essential goods, including food aid and medical supplies, from reaching the millions in urgent need of assistance.
Charity organizations across Tigray say that they are unable to provide assistance despite large scale of humanitarian catastrophe unfolding in the region. The charity organizations say that the ongoing siege on Tigray that has blocked all essential public services, including banking and telecom, has made it impossible for aid organizations to continue to provide assistance. Wayne Takidana has more.
Following the outbreak of the war in Tigray, the government of Ethiopia has put the region under an all-encompassing siege by blocking all roads that led to Tigray as a tactic of war. The central government has terminated basic services such as telecommunications, electricity, and banking systems, making it impossible for civilians to get on with their lives. Many are suffering from lack of food and medication. Care receivers at Human Beings Association of Brotherhood and Freminatos Elders for Mentally Disabled and Children charity organizations operating in Mekelle say that their work have been greatly affected by the siege.
We are having big problems. Everywhere you go, Tigrayans are being beaten or killed, and the ones that survive the violence are suffering from hunger, thirsty, and lack of medications. We are in trouble.
We live in a darkness with no telephone, network, banking system and transport services. There is no food or medication. We are in grave danger. I have a chronic illness, but I can't get treated because there is no medicine here. We are in a difficult condition.
Heads of the charity organizations, Father Gabramadhan Berha and Fara Asafa, say that since the beginning of the siege, the main source of income for their organizations, which is the community, have been under a huge economic crisis, and without donors, the care receivers have been dying of hunger and lack of medicine.
People are starving. There are people who can't afford food even once a day. It's sad to see retired elders suffering from starvation. The siege has put us under a tough situation.
Freminatos charity organization is in a big crisis due to lack of food. We are in a condition where we can provide food only once a day. There are elders, children and mentally disabled people that have been depending on us. So hard to explain what's going on to babies or the mentally challenged. Even if you try, they will not be able to comprehend it. Most of the care receivers in our organization need diaper, but it has become impossible to provide them because of the siege. If things continue the way they are now, we are worried that things may go out of hand. We can't turn them back to the streets where from we brought them.
Leaders of the organizations and the care receivers who have no life without this organizations call on the international community to put an end to the torment by taking meaningful actions instead of the rhetoric condemnations to break the siege.
I ask for UN and other aid organizations to pay a little attention to our lives. We are humans dying of hunger. Please don't give Tigray a cold shoulder.
We are shouting at the top of our voices, if the word may help us.
We are concerned about
The international community should step aside from giving statements of rhetoric condemnations. They need to send us food instead of dropping bombs because we are only humans.
We are starving because of the siege. There should be free entrance for humanitarian aid. There should be a way to move humanitarian aid into Tigray. Giving statements of rhetoric condemnations isn't in our best interest, because if the concerns are true, you would have already done something about it. I call on the international community to support the people of Tigray.
According to reports by UN OCHA, more than 1 million Tigrayans are under famine-like conditions and 5.2 million are in urgent need of food assistance.
Tigray has been under a complete communications blackout for the past 6 months, with the Ethiopian government discontinuing all services to the region, including cell service and the internet connection. Now, medical professionals say that this has had a devastating impact on their capacity to provide services. Betele Mayela has more on this.
People in Tigray are dying, suffering due to lack of medical supplies, and they are in urgent need of humanitarian assistance. As the 7-month-long siege continues. As the internet and network connections are stopped, it exasperated the damage that is happening to the people of Tigray. Eider Comprehensive Specialized Hospital, the largest hospital in Tigray, used to give full service to its patients, as it had enough equipment and medical supplies. But now, the hospital reported that it has been unable to give proper service to its patients, as its medical equipment stopped working due to the internet and communication blackouts. And there is no network service to communicate with its patients. Abdulhafiz Mohammed is a communication worker at the hospital. He says that the communication blackout has made it difficult to give service to the patients.
We used to use this phone to call our patients and tell them if there was any change on their appointments so that they can come earlier or later. But now we have completely stopped using it since June. There is no internet or network connection in the region.
Mr. Gaurihiwat Brahanu, a coordinator at the radiography unit, also says that many equipments of the hospital have stopped working due to the internet blackouts.
It's been almost a year since the MRI machine stopped working due to the internet blackout. And this is the CT scan machine. It is the only machine in Tigray. We had been using this machine to scan the human brain to see if there are any injuries. We have used it for 10 years. But now patients are dying as the machine has stopped working due to the internet shutdown.
The acting administrator of Northern Region branch of Ethio Telecom, Mr. Tesfahun Gersh, says that the internet and communication blackouts affect hospitals badly.
There are medical equipment that need internet access in order to update their software and work properly. Previously, if something went wrong with the equipment, it was easy to fix them using the internet access. But now there is nothing we can do to make it work without the access to the internet.
The internet and total communication blackout has affected not only the medical equipments and lives of millions of Tigrayans, but also Ethiopia's economy. According to BBC Tigrinya, Ethiopia has lost $164.5 million from shutting down the internet, putting herself second from Africa.
Tigray's health system was considered a model health system in the developing world, with its primary areas of focus including the well-being of mothers and children. With the massive expansion of infrastructure, Tigray's health system had also been able to show a significant increase in sharply declining child as well as maternal mortality. Our reporter Auraha Gauratansay looks at the growth of the health system and its rapid decline in the past 14 months when the Ethiopian and Eritrean forces deliberately and systematically attacked its infrastructures.
Before the start of the conflict in 2020, Tigray's health system had been considered a model for healthcare provision across the world. A massive expansion of infrastructure and health facilities had enabled Tigray to achieve the Millennium Development Goals in reducing child and maternal mortality. Dr. Ray Isaias is the deputy head for the Bureau of Health. He says Tigray's health system had shown a drastic improvement over the past 5 years.
midwifery ከዓ መዋልዳ እንብለን ከዓ ካብ 1.5 ብናይ ውድብ ጥዕና ዓለም መለክዒ ናብ 1.4
In the previous 5 years, the ration of healthcare workers to mothers and children ratio went from 1 to 22,000 to 1 to 12,000. The ratio of midwives to pregnant women has gone down from 1 to 5,000 to 1 to 4,500, with 80% coverage of basic medical supplies, and we had achieved 95% information quality service. Antenatal care provided by trained professionals had reached 81%. This data was later confirmed by Tigray Statistics Office. All types of vaccination for children had reached 92%, and 100% health centers had been able to provide vaccinations, while 100% of our health facilities were able to provide antenatal care.
ትካላትና ብሙሉአን 100% ብዝባሃል ክታበት ግልጋሎት ዝህባሉ ዝነበራ ትካላትና ብሙሉአን ናይ ወሊድ ግልጋሎት አዴታት ዝህባሉ ዝነበራ ኢኔሮ
Dr. Ray added that the health and well-being of children had shown a rapid increase over the past 20 years, especially due to an increased level of awareness about the use of vaccination and improved accessibility.
ጸረ ናይ ፖሊዮ ክትባት ዳርጋ ፖሊ 1.2% ኢኔሮ
Vaccination of polio 1 and 2 was almost 100%, and vaccinations for measles reached about 90% except for measles 2 in one health center. That was 53% for exceptional reason. 100% of health institutions were providing vaccination service.
Dr. Awol Yemane, a gynecologist at Either Comprehensive Specialized Hospital, also says that maternal mortality had significantly reduced with improved access to quality maternal care.
We had fairly good enough resources which were enough to serve our patients well. So some of the figures, the maternal death rate was around 10 per annum per year, 10 to 15. Stillbirth around 100. Antenatal care coverage was close to 100%.
Today, Tigray's health system has completely collapsed with more than 80% of its infrastructure destroyed and the remaining 20% unable to provide services due to lack of medical supplies, affecting child and maternal mortality across Tigray.
ወሊድ ግልጋሎት ብሰልጠነ ባዓልሙያ 81% በጽሕ ነይሩ ተይልና
Delivery by trained professionals declined from 81% to around 25%. This means that just 25% of women are receiving professional medical care as opposed to the 81% before the conflict. Maternal mortality has also shown a sharp increase because women are now delivering at home, and this means that they are not able to receive proper treatment if they bleed, develop an infection or bleed excessively. This means that over 80% of mothers that could have been saved are now in danger.
After the war broke out, all our aspirations and hopes fade away, and we are like days tell us. So we are counting maternal days day in, day out. The number of maternal days has significantly increased, alarmingly increased, fourfold. So we have hit 30 mark 1 month back, and we are having more and more of maternal days. So several mothers are dying in their prime age.
In addition to the destruction of health facilities, the past 7 months under siege has meant that even functional health facilities will no longer be able to provide services due to lack of medical supplies.
My name is Dr. Debesay Abrahalle. I am a general practitioner at Birshwa Hospital. The hospital was attacked by Eritrean troops when they first invaded the area. It is difficult to say we are providing any medical service here. Children and mothers are suffering. We refer many of our patients to other hospitals because we don't have medication, and we are also not able to perform surgeries, and the patients don't have any money for transport, so mothers are forced to deliver at home.
We have many children in the pediatric ward. They are on the verge of death due to the shortage of food and medication. We have lost the lives of 15 children so far.
Lack of medical supplies and the deliberate destruction of health facilities is not the only factor affecting healthcare provision in Tigray. The health and well-being of the community and the health system's capacity to cope up has also been affected by other factors such as the deliberate destruction of food items and the blockade of food aid.
I am here to deliver my child, but as you can see, there is no hope. All the beds are taken and the rest are broken. There is no mattress. I gave birth here before, and the delivery room was well equipped and the midwifery wards were complete. You can compare the facility now to the way it was previously.
I came here because my child is suffering from malnutrition and anemia. I came here so my child could get medical care, but there is no medication. The reason I am here is because my child is suffering from malnutrition. He hasn't excreted yet. The hospital has run out of medicine and it seems unlikely I'll get any medical care here.
Takhla'ab Gavramariam is the coordinator of the pediatric ward at Aider Hospital, and he says that the drastic increase in child malnutrition had added an additional burden on Tigray's already collapsed health system.
This child has come here to get treatment for malnutrition. His mother could not get adequate food during pregnancy, so she was born underweight. Many children come to hospital on a daily basis due to malnutrition. The siege has affected everyone. He is just 3 months old, but he looks like a grey old man. We have treated 166 children due to malnutrition, while 14 children have lost their lives in just the 4 months since June 21, 2021. Now, we have to completely discontinue service for malnutrition because of lack of supplies to treat them with.
معروض خونه سرعة مجاجوا كل خلّه بفلاي أبناء مجمّر حدش معلتات.
The first 1,000 days are the most critical in terms of the physical and mental well-being of a child. Nutritionally speaking, we are in a terrible situation. Based on IPC, almost 51 vicinities are at IPC 5 level or in famine-like conditions. Based on our preliminary assessment, acute malnutrition was 0.3 in 2012, but now it reached 3.3%. If the acute malnutrition is above 3, it is critical based on IP classifications. Based on GAM, Tigray is above 15%. Normally, if it is above 15%, general food distribution is needed. This doesn't mean only wheat and oil, but nutritious food too. But we are unable to get any food aid and the situation is getting worse day by day.
So بتعمي important زبال. ناي مجمّر حدش معلتاتون. رخو زقبّا مجبي كي رخو يوم كحلفو مالتيو. سزي ناي دخل ناي سنامرون أكلان عبيت تجودات يوم كخون.
Dr. Ria says he believes that the attack on Tigray's health system was deliberate and part of the genocidal war waged on the people of Tigray.
The objective is clear. It has been to exterminate the people of Tigray by denying them access to essential medication, causing this due to malnutrition, chronic illnesses and pandemics. Tigray's health system was an exceptional in terms of prevention and treatment. Tigray's health system was working towards producing healthier and more productive society. And so the invading forces saw this as a threat. This is why they targeted the health system. This is part of the genocide. They are starving children so their growth is stunted.
نتحساسبان رديتنا يصلاتنا حدغا كون سلازخل ابزيت كيركا مسرح ابزيت كيركا نعناو قندي نتو نايزر مصنات منجدي
The destruction of health facilities has had a significant impact on the most vulnerable members of society, especially mothers and children. Our reporters visited Kasich Asfal Health Center where patients say they're not able to access vaccination due to the ongoing siege on Tigray. Sablor Lema has the details.
The almost 7 months long siege on Tigray has had a devastating impact on most of vulnerable members of the community, especially children affected by multiple factors including lack of medical supplies. Kasich Asfal Health Center in Maqala was built in 1997 by Tigrayan Association based in Northern America in association with Tigray's Bureau of Health. Today, the health facility has completely run out of even the most basic medical supplies, including vaccination vital for the proper development of children.
I am pregnant. I came here to get vaccinated. They told me that there is no medication, so I am going back home. I also went to Maqala Health Center. and they said there is no medication there either.
I came here to vaccinate my children, but they say they don't have any, so I have to go back home. This was intentionally done to exterminate Tigrayans.
I have been trying for the past months, but I'm not able to get vaccination for my child. But it is not only the lack of medication, there is also no food. We are starving. My child was supposed to get vaccinated within 45 days, but I couldn't get anything, so I'm going back.
Sister Latabrahan Gabra Maskal is a coordinator for maternal and child health care, and she says the clinic no longer has any medication.
Now we have completely stopped giving vaccinations to children. Those includes those that have to be taken in their first 45 days. This is all due to the siege. This is against basic principles of human rights and the rights of children to receive vaccination.
It is to be recalled that no trucks carrying humanitarian assistance have entered Tigray since December 15, 2021, while the United Nations estimates at least 100 trucks of food aid needs is necessary to reach the millions in need of emergency assistance.
For nearly 7 months now, all essential goods, including food and medical supplies, have been blocked from entering Tigray. As a direct result of this, the lives of many have been lost. Our reporter spoke with the chronically ill patients suffering from the depletion of medical supplies at Lemlem K. Carl Hospital. In Maicho, Salome Tchlai has more.
Are deteriorating as they can't find the medications they need.
I used to come and take medications every month, but there is nothing now. There is no option but to wait for your death, because I can find the medication. I'm finding it difficult to move my hands and feet like I used to.
She's my mother, and she's hypertensive. There is no medication she can take now. Many hypertensive people are dying as they can't find medication.
I take medications for my gastritis and goiter because of the siege. There is nothing for us. We come every month to check for availability of medicines, but there is nothing.
Medical director of Lemlem Karl Hospital in Maicho, Dr. Aklilu Alamayu, says that the hospital is unable to give medical care to its patients as there are no medical supplies coming into Tigray because of the complete blockade.
Medications needed for patients with chronic illness like hypertension, diabetes, and cardiac problems are depleted in this hospital. Because of this, patients are losing their lives.
The medical director also expressed his grave concern that the worst effect of the siege is in mothers and children.
Mothers and children are the most affected ones. Since there is no fuel, ambulances are unable to give service. Hence, mothers in labor are having it difficult to arrive at the hospital. As a result, mothers are bleeding to death or they develop problems in their uterus. Their babies too are dying.
The lives of many have been lost due to the depletion of medical supplies, a humanitarian catastrophe, all too preventable by ending the